chapters. We're going to tackle two different chapters. One of the chapters is personality disorders, and the other one is gender and sex and gender issues. The two don't have anything to do with each other. I just needed to put two chapters together, and I was looking at a number of slides on the PowerPoints, and this is the way I did it because both of these have about 70. We're going to end up talking about going through 150 slides. And I apologize about that, but hey, this is summertime. If this were, if this were the spring or fall with a 15-week semester, we'd be able to tackle each of these individually. And probably we should. But, one of the problems is that we don't have we have only 10 weeks, and we've got to get all the material in. What am I going to skip? I don't know. Let's skip schizophrenia. No, we can't do that. So other people do, and other instructors do. I don't really agree with it. I think if you're talking about abnormal psychology, you better hit everything because there's a lot of problems out there, and they take a lot of different forms. So let's go ahead and get started, or I'll be here until this afternoon. I have to go out and mow this today. So let's talk about personality disorders. This is my favorite chapter, strangely enough. I find the personality disorders just fascinating because, of course, I've moved around a lot and I've run into a lot of normal, abnormal behavior, and this one I can really identify with because I've seen so many of these. So let's go ahead and get started. Personality is not a thing, but a way of acting and thinking. Individuals develop broad characteristic ways of viewing and organizing their world, interacting with others, and coping with challenges. And different places have different ways of doing things. The Navajo Nation is certainly not the same as Gallup or Albuquerque. I was shocked when I went to Albuquerque. People are kind of mean in Albuquerque. That was a little strange. These approaches to the world tend to become more stable and predictable as people grow from childhood to adolescence to adulthood. And if you've ever been around somebody long enough to watch them grow up, sometimes their personality will change from childhood to adolescence to adulthood. Hopefully they do, especially if they're a bully when they're a child or when they're an adolescent. You don't want them to be a bully when they're adults. A personality disorder is a very rigid pattern of inner experience and outward behavior. The pattern is seen in most of the person's interactions, continues for years, and differs from the experiences and behaviors usually expected of people. The rigid traits of people with personality disorders often leads to psychological pain for the individual and social or occupational difficulties. The disorder may also bring pain to others. Personality disorders typically become recognizable in adolescence or early adulthood, although some start during childhood. These are among the most difficult psychological disorders to treat. One of the reasons they're so hard to treat is because sufferers are not aware that of their personality problems. They think this is just the way I am, and this is the way I've always been, and this is the way I'm going to be in the future. By golly, you can't change me. They failed to trace their difficulties to their rigid style of thinking and behaving. It has been estimated that between 4 to 15% of all adults may have a personality disorder. And you can think of all your friends, you can think of all your professors. What kind of personality disorder does he have or she have? Some individuals are not particularly bothered by their own personality patterns. They may not seek, cooperate with, or accept clinical involvement. It is common for people in treatment to have personality and other mental disorders concurrently. There are significant overlaps among the symptoms of the 10 DSM-5 personality disorders. And this is part of the problem. A lot of times You can't treat it because they don't see this as a problem. They gain advantage from it, and if they gain advantage from it, they're going to want to continue to use it. Grouchy people, the reason they're grouchy is because the result is what they want. They want people to stay away from it. They want people. They want to control people with their unpleasantness. Reliability problems have plagued the personality disorder classifications. The DSM-3 reliability field trials found capita values of 0.56 and 0.65 across the two phases. The DSM-5 field trials found the reliability for borderline personality disorder to be a questionable 0.36 borderline personality disorder. This is a fun one. I've got a song for this, and maybe no, I can't play it because if I play it, it's copyrighted and they won't let me. I'll have to redo the lecture. However, personality disorders appear to be very common among the mental health population. Nearly one-third of all of the patients interviewed by Zimmerman et al. In 2007 met the criteria for at least one personality disorder. When the personality disorder not otherwise specified category was included, the rate increased to almost one half of the group. What does that tell you? What that should tell you is that most people with mental, who are diagnosed with some kind of mental disturbance, personality disorder is also a problem that they have, whether they've been diagnosed with it or not. Personality disorders are difficult to treat. Comorbidity with other mental disorders is common. Up to 50% of patients with either schizotypal personality disorder or borderline personality disorder also meet the criteria for a depressive disorder. In many cases, treatment is directed at the particular deficits or symptoms rather than any underlying condition. And this is part of the problem. They've got borderline personality disorder. What do you treat them for? You don't treat them for the borderline personality disorder. You treat them for the depression because the depression is causing more problems. There are treatable symptoms for depression, and there are not that many treatable symptoms for borderline personality disorder. So you get rid of their depression first, and then you try to deal with the borderline personality disorder. If you can get them to come back, once the depression is gone, they're feeling better, and they don't want to deal with the borderline personality disorder. So you never see them again. Personality disorders are grouped into three clusters: odd behavior clusters, paranoid personality disorder, schizoid personality disorder, schizotypal personality disorder. The odd behavior cluster is not that common. Dramatic behavior cluster is common. It's very common. Antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. This is relatively common. The high anxiety cluster, avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder, they are fairly common as well. This cluster in personality disorders involves symptoms described as odd or eccentric. Normally, these symptoms are not of sufficient intensity to include delusions and hallucinations, although when individuals are under sufficient stress, brief psychotic states ranging from minutes to hours may occur, but because we don't want to treat them with anything too extreme, we will assume that it is temporary. So we won't treat their psychotic behavior unless it happens again, unless it happens more frequently, or unless it's for longer durations. These disorders invariably involve restriction of social connection with others, as seen in schizophrenia including extreme suspiciousness, social withdrawal, peculiar ways of thinking and perceiving things. Such behaviors often leave the person isolated. Well, the paranoia will leave them. Oh, I guess it is paranoia. About 5.7% of the population meets the criteria for at least one of the cluster A diagnoses. Conspiracy theory, that was if you have ever watched that movie, it's a really interesting movie. It has Julia Roberts, I think, is the reporter that this individual is trying to communicate with. And of course, Mel Gibson is the male lead. But he's extremely paranoid about just about everything. People with paranoid personality disorder are distrustful, suspicious, and expect others to take advantage of them in nearly all circumstances. They do not show a sense of humor and rarely relax or let down their guard in social situations. They consider jokes that you're laughing at them. That and that's tough. You can't tell them a joke. They never smile. They don't get humor. They always think you're trying to make fun of them. They're very, yeah, they're pretty paranoid. They take offense readily and hold grudges easily for some unintentional slight that they have interpreted as malevolent. These characteristics help to keep them isolated from others, and they typically have few or no close friends or confidants. Jealousy and envy, together with an excessive view of their own self-importance, are characteristic. Now, the interesting thing about paranoid personality disorder is that these individuals consider themselves highly intelligent. And they're the only ones who can see. I just let the dog out. Who let the dogs in? Yeah, they consider themselves very intelligent. And for that reason, they see everybody else is not as bright as they are. Obviously, you're not as smart as they are because they see all of these negative things that you were just ignoring. So they consider themselves quite bright. The paranoid pattern of interacting with others may be traceable to childhood, but must begin by early adulthood for the diagnosis to occur. During periods of stress, those with paranoid personality disorder can experience brief psychotic episodes. Co-occurring disorders tend to include major depressive disorder, agoraphobia, obsessive-compulsive disorder, and substance disorders. National surveys have estimated that the prevalence of paranoid personality disorder at between 2.3% and 4.4% of the general population. That's a lot of paranoia. These conspiracy theories that became so popular during the Obama administration had to do with, well, it's really kind of hard to say. As a psychologist, I would say it had to do with fear of black people. There has been a natural fear. My goodness, you can't keep people enslaved for an extended length of time without there being a reaction. And that reaction, as was the assumption of many white people, was that they hated us and that they wanted to do us harm. And for that reason, there was a lot of conspiracy theories that came out of Obama's administration. There was a lot of paranoia, and it continues to this day. Donald Trump tried to do away with anything that Obama had Obama's name to it. He tried to get rid of it during his first administration, as weird as that is. Paranoid personality disorder is more commonly diagnosed among males than females. It has something to do with testosterone. We're not exactly sure what. Psychodynamic theorists see the individual with paranoid personality disorder growing up with demanding parents, a particularly distant and rigid father, over-controlling and rejecting mother. So they had to go into their own mind to understand things. They couldn't. The father was too distant and rigid, and the mother was too over-controlling and rejecting. So they had to live in their own minds. They view their own environment as unfriendly because those from whom they are supposed to gain unconditional love reject them, both their mother and their father. Twin studies show that such behaviors manifest in both individuals, therefore, there may be a genetic cause, but we're not exactly sure what, because in twin studies, both of the children are getting the same treatment from their parents. People with paranoid personality disorder do not typically see themselves as needing help, and thus few seek help willingly. They typically distrust and therefore rebel against their therapist. Therapy is often long and rarely productive. Different therapists focus on different aspects of the problem, but the end result is often reducing a select symptom, but certainly not getting rid of the problem. Drug therapy is generally ineffective for these individuals. For one thing, they don't trust any drugs that you're going to give them, and the way it makes them feel. Remember, these are conspiracy theorists. These are individuals that don't trust anyone and don't trust anything. So you can treat a symptom and get rid of that symptom, but you get all the other symptoms still there. So treating people with paranoid personality disorder is a losing proposition. People with schizoid personality disorder persistently avoid and are removed from social relationships and show little in the way of emotion. These people do not have close ties with others. The reason they avoid social contact is because they prefer to be alone. I want to be alone. They're often described as loners and make no effort to start or keep friendships. They take little interest in having sexual relationships, and they even seem indifferent to their families. I can't show that, sorry. But you can look at it. It's Greta Garbo in a movie, and she says, I want to be alone. People with schizoid personality disorder seek out jobs that require little or no contact with others. When necessary, they can form work relations to a degree, but they prefer to keep them to themselves. Many live by themselves, they have weak social skills. If they marry, their lack of interest in intimacy may create marital marital and family problems. Their focus is on themselves and they are generally unaffected by praise or criticism. Sorry about the pun. People with schizoid personality disorder rarely show any feelings, expressing neither joy nor anger. They have no need for attention or acceptance. They are viewed as cold, humorless, and dull. They generally succeed in being ignored. Estimates are that 3 to 5% of the population has schizoid personality disorder. Slightly more men than women suffer from it and may actually be more limited by it because women are more acceptable. Ruby is a successful sanitation engineer involved in the planning and maintenance of water resources for a large city. Ruby's job calls for considerable foresight and independent judgment, but little supervisory responsibility. She's appraised as an undistinguished but competent and reliable employee. There are few demands on an interpersonal nature made on Ruby, and she is viewed by most of her colleagues as reticent and shy, and by others as cold and aloof. Difficulties centered around her relationship with her husband. At his urging, they sought marital counseling for, as he put it, she is unwilling to join in family activities. She fails to take any interest in the children. She lacks affection and is disinterested in sex. People with schizotypal personality disorders display a range of interpersonal problems marked by extreme discomfort in close relationships, very odd forms of thinking and perceiving, and behavioral eccentricities. They seek isolation and have few close friends. The disorder is more severe than the paranoid or schizoid personality disorders. The thoughts and behaviors of people suffering from schizotypal disorder is noticeably disturbed. This is another one. Sheldon. This is when Leonard actually rented the room from Sheldon. It's only 52 seconds. It's on YouTube. I can't show it. Sorry. You need to go back and see these because they're perfect. uh, it'll allow you to really understand what we're talking about. Symptoms may include ideas of reference, beliefs that unrelated events pertain to them in some important way, bodily illusions such as sensing an external force or presence. A number of people with this disorder see themselves as having special extrasensory abilities, and some believe that they have magical control over others. Schizotypal eccentricities may include arranging cans to align their labels, organizing closets extensively, wearing an odd assortment of clothing. People with this personality disorder have a great deal of difficulty keeping their attention focused. Thus, their conversations may be unclear, even sprinkled with loose associations. They tend to drift aimlessly and lead an unproductive life. They're likely to choose undemanding jobs in which they can work below their capacity and are not required to interact with other people. It has been estimated that 3% of all people, slightly more males than females, may have this disorder. Antisocial personality disorder, people with antisocial personality disorder persistently disregard and violate others' rights. Aside from substance-related disorders, this is the disorder most closely linked to adult criminal behavior, and I have a picture of Ted Bundy, the mass rapist, serial rapist. And there he is again. The disorder usually surfaces before the individual reaches their 15th birthday, usually in the form of truancy, running away, physical cruelty to animals or people, destroying property, and setting fires. Ted Bundy was the product of a very young lady. She was 12 or 13 when she had him, and he was raised by his grandmother, and he thought his mother was his sister. Caused lots of interesting problems. Oh, this is Jeffrey Dahmer. People with antisocial personality disorder lie repeatedly. Many can't work consistently at a job. They're absent frequently and are likely to quit suddenly. They tend to be careless with money and frequently fail to pay their debts. They tend to be impulsive, often failing to recognize consequences of what they do. They tend to be irritable, aggressive, and quick to start fights. Recklessness is another common trait of people with antisocial personality disorder. They tend to be self-centered and have trouble maintaining close relationships. They very often become con artists and seem to have a knack for getting people to do what they want. 3% of the people in the United States have this disorder. Whites are most prevalent group of that manifests the problem. Men are 4 times more likely to have it than women. Criminal behavior seems to decline after the age of 40 when their testosterone goes down. What was this guy? This is a guy from California. They made a movie about it. Well, they've made lots of movies about it. Many behavioral theorists have suggested that antisocial symptoms may be learned through modeling or imitation. I'm trying to think of his name, so I'm thinking in 2 directions at the same time. Some psychologists see parents reinforcing this behavior by reinforcing or ignoring aggressive behavior. People with antisocial personality disorder tend to respond to stress or anxiety with lower brain and bodily arousal. Thus, punishment has little effect on them. It runs in families. Relatives of females with the condition are at higher risk than relatives of antisocial males. Both adopted and biological children of parents with antisocial personality disorder show higher risk for the disorder, indicating both a genetic and an environmental factor. The most widely accepted view is one of interacting environmental and genetic influences within the context of dynamic coercive parent-child interactions and supportive peer group influences. Well, many incarcerated individuals suffering from antisocial personality disorder receive treatment, nothing appears to be effective. One study showed that 70% of the people suffering from antisocial personality disorder left therapy early, mainly because they're so much smarter than their therapist. Since most therapy depends on developing a relationship with a therapist, antisocial people do not have the basic need to be helped for by therapy. They cannot develop a relationship with anybody. Everything is superficial. They're so much smarter than everybody else. It just gets weird. People with borderline personality disorder display a great instability, including major shifts in mood and unstable self image and impulsivity. Due to these symptoms, individuals who suffer from borderline personality disorder tend to have unstable relationships. These individuals seem to always be in conflict with the emotions of their environment. They may be physically aggressive toward others during their bouts of anger, or they might turn their anger on themselves. And cut, or cutting is relatively common. They'll burn themselves with cigarettes. Uh, they attempt suicide. And we'll see that in just a second. Why is Ted Bundy, the name Ted Bundy, running through my head? I got Jeffrey Dahmer. I can't think of his name. Charles Manson. It was Charles Manson. There you go. Charles Manson. Once Upon a Time in Hollywood is about the Manson family, actually. And it's a fantasy of them saving their lives, or not actually murdering Sharon Tate and the people in that house. Okay. Oh, there we go. These people are characterized by impulsive, self-destructive activities that may range from alcohol and substance abuse to delinquency, unsafe sex, reckless driving, and cutting themselves. Suicidal threats and actions are also common. Studies show that 70% of people with borderline personality disorder attempt suicide at least once in their lives. 6 to 9% actually commit suicide. They may try to hurt themselves as a way of dealing with their general feelings of emptiness, boredom, and identity confusion. Part of the problem is they can't be happy. So everything's going along really good. They need extremities. They need extreme feelings. So if everybody's happy, then they try to create chaos. People with borderline personality disorder frequently form intense conflict-ridden relationships in which their feelings are not necessarily shared by the other person. They often violate the boundaries of relationships and may become furious when their expectations are not met. They remain very attached to their relationships, paralyzed by the fear of being left alone. Sometimes they cut themselves or carry out other self-destructive acts to prevent their partners from leaving. This happened to me. I married somebody with borderline personality disorder. My first wife probably had it. She didn't really cut herself, but she kept attacking me. But finally, she used to hit me with things. Finally, she stabbed me in the arm, and then she stabbed me in the chest. Funny story. About 2% of the population are believed to suffer from borderline personality disorder. 75% of the patients receiving this diagnosis are women. The course of the disorder varies, but the most common pattern is for the instability and risk of suicide to reach its peak during young adulthood and then gradually lessen with advanced age. These people tend to have childhoods marked by multiple parent substitutes, divorce, death, or traumas such as physical or sexual abuse. Studies show that impulsive or physically aggressive borderline sufferers have lower brain serotonin levels. Therapy can be successful if linked with medication. You have to raise their serotonin level. So you give them SSRIs. The stronger, the better. Therapy, if linked with medication, antidepressants, anti-bipolar, anti-anxiety, and antipsychotic drugs do help. Um, Start out low, and if it doesn't work, then keep moving. Keep moving up. Start out with antidepressants, go to anti-anxiety drugs, then go to anti-bipolar drugs, and then antipsychotics if you can't reach them. Potentially, what you're doing is you're diagnosing them as borderline, and they're actually suffering from schizophrenia. Susan had recently divorced her husband of 5 years and fought desperately to retain custody of her two boys despite her two suicide attempts the year before. One day she drove to the local lake with her two boys strapped in and sleeping in the back seat and pushed the car into deep water. She then called the police and told them that a black man had carjacked her vehicle with her babies inside. This is a true story, by the way. After days and television pleas, her car was found in the lake with her two dead children in it. It turned out that Susan had started having an affair with a rich customer at the restaurant where she worked and had decided to chuck it all for love. The suicide attempts occurred when she first decided to set her cap for her customer. She didn't actually seduce him until 6 months later when she followed him into the restroom late one night. The man did not really know her circumstance, and she killed her boys because of her customer's lukewarm reply when she asked him if he had any kids. The main features of histrionic, and that's, she had borderline personality disorder. That's Susan. I can't think of her last name. Main features, but it's a true story. Main features of histrionic personality disorder: excessive emotionality and attention seeking. Rapidly shifting emotions may seem shallow, superficial, and exaggerated. There seems to be a desire to be the center of attention and act dramatically through both behavioral intensity and physical appearance. They may fish for compliments, act flirtatiously, and pretend that relationships are more intimate than they are. They often assume either a victim or a princess role. They display manipulative suicidal gestures, often with the goal of attracting attention. They tend to seek out novelty and excitement, easily becoming bored with routine. The general incidence appears to be close to 2% of the population. Although the diagnosis is given more often to females, the DSM 5 notes that the ratio is not significantly different from the proportion of females in treatment. Fear of abandonment seems to be the root cause of histrionic personality disorder. Socioculturalists feel that our society encourages adolescents and young adults to hold on to childhood and dependency as long as possible, especially girls. These individuals do tend to seek therapy, but for obvious reasons, they are difficult to work with. Therapy tends to be aimed at demonstrating to the client that they are overly dependent. Drug therapy is not very successful except to relieve the infrequent depressive symptoms. Suzanne is a vivacious and attractive woman. She sought therapy in the hope that she might prevent the disintegration of her third marriage. The problem she faced was a recurrent one: her tendency to become bored with her husband and increasingly interested in going out with other men. She was on the brink of another affair and decided that before giving way to my impulses again, she had better stop and take a good look at herself. Suzanne's first husband was a rich bum that she met in art school. They started sleeping around on each other before the first year. She wasn't sure if her daughter was actually his. She soon met and married a man twice her age who gave both her and her daughter a nice home, attention, and love. The marriage lasted 4 years before Suzanne got the old itch again. Her affairs had actually begun in her third year of marriage, and she went through a whole platoon of men before her husband caught on. She next met and married her streetwise husband and has stayed faithful to him for 3 years. She enjoys flirting but is yet to falter. Those displaying narcissistic personality disorder are self-centered and require the admiration of others. They exaggerate their own self-importance and are preoccupied with fantasies about their own success, brilliance, or beauty. They commonly feel entitled to special treatment, lack empathy, and exploit others for their own purposes. They are described as arrogant, conceited, elitist, and grandiose. They are frequently contemptuous of others. How do they get away with all this stuff? It's because they're so pretty. Although preoccupied with self-importance, their self-esteem is actually very fragile. Criticism may hurt them, leaving them empty, humiliated, and primed for counterattack. Narcissistic personality disorder may co-occur with anorexia nervosa and substance, especially cocaine use disorders. More commonly given to males, prevalence is unclear. Estimates range from 0 to 6.2%. People with narcissistic personality disorder are seldom interested in the feelings of in the feelings of others. They often will take advantage of others to achieve their own needs. They may react to criticism or frustration with bouts of rage or humiliation. Others may react with cold indifference. Some cognitive psychologists feel that narcissistic personality disorder is caused when children are treated too positively early in life. Admiring, doting parents may be teaching them that they are superior and that they should overvalue their self-worth. Firstborns and onlys tend to have higher levels of narcissism than anyone else. These people tend to be so arrogant that they are very difficult to treat. Steve's wife complained that Steve as being selfish, ungiving, and preoccupied with his work. She claimed that he contributed nothing to the marriage except his meager income. He refused to do anything around the house, expecting her to wait on him hand and foot. He did seem to be a gentle fellow and fairly good-natured. Stephen's wife complained that he needed a doting mother rather than a wife. Steve is affable, self-satisfied, and a somewhat disdainful young man. Most people viewed him as a bit self-centered, cold, and snobbish. He admitted that he wasn't interested in making anyone else happy but himself. Cluster C personality disorders included those in which symptoms presentations tend to be avoidant or fearful. About 6% of the general population displays at least one of the cluster C disorders. People with avoidant personality disorder believe themselves to be unappealing or inferior to others. They exaggerate the potential difficulties of new situations, so they take few risks and rarely try new activities. Bert. There you go. You need to see this one too. This is good. Bert has avoidant personality disorder. People with avoidant personality disorder usually have few or no close friends, though they actually yearn for intimate relationships and frequently feel depressed and lonely. As a substitute, some develop an inner world of fantasy and imagination. Between 0.5 to 1% of adults suffer from the problem. Building self-esteem seems to lessen the effects of avoidant personality disorder. Anxiolytics and antidepressants work as well. There is a significant overlap of symptoms and high comorbidity between avoidant personality disorder and social phobia, which may suggest a common biological underpinning. Others argue that avoidant personality disorder should be considered within the schizophrenia spectrum. Possible psychological causes include parental or peer rejection in childhood, although little empirical evidence exists for any specific causal factors. Pharmacological approaches to treatment of avoidant personality disorder essentially assume that the condition has a common basis with that of social phobia. Case reports suggest certain antidepressant medications, MAOIs, may be helpful. Behavioral treatments that involve graduated exposure and social skills training have been shown to be effective. People with dependent personality disorder have a persistent, excessive need to be taken care of. As a result, they are clinging and obedient, fearing separation from their parent, spouse, or other close relationships. We used to call this codependency, and codependency is where two people, one person needs to be needed by the other, and the other person needs to have somebody need them. So it's a form of codependency. We see this. We see codependency a lot with alcoholics. Alcoholics will marry someone that lets them be an alcoholic. So there's a codependency. Um, she needs to be needed by him, and he needs to have somebody that will allow him to drink. Um, and sometimes when if we have an alcoholic and he or she gives up stops drinking, the relationship actually breaks up because she's no longer desperately needed, or he's no longer desperately needed. As weird as that is, people with dependent personality disorder rely on others so much that they cannot make the smallest decision for themselves. These individuals feel completely helpless and devastated when the close relationships end, and they tend to quickly fill the void with another relationship. Many cling to relationships with partners who physically and psychologically abuse them. These individuals rarely disagree with other people. They may allow a parent to make all their decisions for them. Many people with dependent personality disorder may feel distressed, lonely, and sad. Often they dislike themselves. Their fear of separation and their feelings of helplessness may leave them particularly prone to suicidal thoughts, especially when they believe that a relationship is about to end. About 2% of the population may have this problem. The problem is just as common in men as women. Therapy is indicated for this disorder, especially group therapy. There are no medications that help this problem. So many personality disorders, there's nothing you can do. You can't take a magic pill. People with obsessive compulsive personality disorder are so focused on order, perfection, and control that they lose their flexibility, openness, and efficiency. Concerns for doing everything right interferes with their productivity. When faced with a task, these individuals may become so focused on organization and details that they fail to grasp the point of the activity. Thus, their work is often behind schedule and they may neglect leisure activities and friendships. These individuals tend to set high standards for themselves and others. They are never satisfied with their work but cannot work with others because they are too careless and incompetent. These individuals are so afraid of making a mistake they are reluctant to make decisions. These individuals tend to be rigid and stubborn, particularly in their morals, ethics, and values. They live by a strict personal code and use it as a yardstick for measuring others. People with obsessive compulsive personality disorder may have trouble expressing much affection, and their relationships are often stiff and superficial. These individuals also tend not to be generous with their time or their money. Some become hoarders, unable to throw away the most worn out item. 1 to 2% of the population has obsessive compulsive personality disorder, and most are white, educated, married, and employed. Men are twice as likely as women to have the disorder. The disorder is similar to obsessive compulsive anxiety disorder, but the individuals don't respond as readily to anti anxiety and antidepressive medications. They do tend to respond to psychodynamic and cognitive therapies. Change your mind, and you change your behavior. A new personality disorder classification in DSM 5 is a personality change due to another medical condition. Persistent personality changes can sometimes be associated with chronic medical problems or events such as stroke, head trauma, epilepsy, autoimmune disorders, or other central nervous system dysfunctions. This diagnosis is appropriate when changes can be directly linked to an underlying medical condition. Other specified personality disorder is a catch-all diagnosis. The overlap and intermingling of personality disorders with other DSM conditions weakens the argument about their independent status, and several writers have called their future status into question. Factor analytic studies of the 10 personality disorders did not support their categorical organization in the DSM-4-TR. In preparation for the DSM-5 proposals to rethink the personality disorders by shifting to diagnosis based on 5-factor models of personality appeared. The DSM-5 moved toward a more dimensional and less categorical model for the diagnosis of personality disorders. Early drafts of the DSM-5 proposed sweeping changes, including reducing the number of disorders from 10 to 6, and added a dimensional assessment component based on a 5-factor model of personality. However, the proposed changes were so extensive that many balked at what appeared to be confusing and time-consuming assessments. The sweeping changes were voted down in the final draft. Given the continued dissatisfaction with their current status, the personality disorders were most likely to be revamped with the next update of the DSM. And I think it has come out. And I've got a copy of it somewhere. Oh, and that's it. Okay, let's move on to chapter 9. Here we go. Sexual and gender disorders. What's right and what's wrong, what's common, what's uncommon. It really all depends on your culture and your religion. That's strange. Well, religion is part of your culture. So here we go. I will have to apologize already because we're talking about sex here, okay? So I'm not going to, I don't know, I can't remember exactly what I showed you. But I do show you the Moche sculpture. So they're a little bit intense. The scientific study of human sexual behavior is a recent endeavor. Researchers have only collected data on the prevalence of different kinds of sexual behavior since the mid-1900s. Since perspective of sexuality became more open, and you got to realize, before that, nobody talked about this stuff. Everybody was afraid of it. Religions kept people from even talking about chair legs as legs. They called them limbs. As weird as that is, because the concept of leg was too sexual. Crazy stuff. Since perspectives of sexuality became more open, the DSM system adopted broader views of sexual variations and dysfunctions. Sexual variations are no longer considered deviations or disorders a priori. Instead, they must be recurrent, persistent, and distressing to the individual in most cases. So the reality is there's a lot of fetishes out there, and as long as you and whoever it is that you're fetishing over agree that it's okay, then that's pretty much okay. Nobody knows what goes on behind closed doors. That's an old Charlie Rich song. And that's pretty much true. People do some strange things to each other for sexual gratification. And, you know, nobody's going to say anything these days, as long as it's two consenting adults. It's got to be an adult. It's got to be a human. This is the Moche pottery, and it was, as you can see, it was very distinctive, and they did a really good job. This was made about 1,500 years ago. These guys were controlled Peru, you know, where the Inca Empire was. I think Machu Picture. Wait a minute. Anyway, moche pottery. There you go. It's pretty distinctive. Whoa, wait a minute. We went from here to here to here. That's a man and a woman having sex. That's a dead person having sex with a woman, I'm assuming. Could be a man, as weird as that is. Okay, the reason I show you this is because we're talking about cultures and we're talking about what's acceptable in cultures, and it may be that it's acceptable to slit somebody's throat. I'm going to have to stop right here.